This was a victory for President Obama, but it's a slam dunk victory for progressives who want to eventually have a single-payer health care system. Or is it? Ultimately, what happened today was that the Supreme Court reinforced our current health care system, which relies on private for-profit health insurance companies. Today, as this chart shows, the United States, on the far left there, spends far more than any other developed nation on health care, yet doesn't get any better health care results from all that spending. And that's because, unlike the rest of the developed world, we rely on for-profit corporations to administer health care in the United States. And since CEOs need huge bonuses to buy new summer mansions, the price of health insurance has to get jacked up. So what does Obamacare do to resolve this problem? How will our health care system look like now, or what will it look like now, after the Supreme Court has upheld the law? Here to answer that is Wendell Potter, former Vice President of Corporate Communications at Cigna, turned health care industry whistleblower and author of the book Deadly Spin. Wendell, welcome.
Thank you, Tom.
Great to have you back with us. To begin with, what's your take on the Supreme Court ruling today?
It's a big victory for Americans. I think there's no doubt about that. I know that some progressives, some single-payer advocates, and I think a minority of those are not too happy about it. They're concerned that they were hoping it would be declared unconstitutional. I think that would have been a very bad mistake. So I think we achieved a great victory here. This will bring a lot of people into coverage who haven't been able to get coverage before. People already are benefiting from it. And if it had been declared unconstitutional, we'd be back to square one, if not worse. And if we lived in an ideal situation or ideal political world, maybe we could just have single payer enacted, but that's just not the way the real world operates.
Yeah, especially when the Republicans control the House of Representatives and have the ability to filibuster in the Senate. You're absolutely right. Could single payer, you and I both agree that single payer is the best way to go, whether it's administered federally or at the state level. And one of the things that is a distinction between Obamacare and Romneycare, or between Obamacare and the original proposal that the Heritage Foundation put out back in the 80s or 90s. I guess it would have been the 90s. They put it out in opposition to Bill and Hillary Clinton's health care program, is that Obamacare has within it a program that, starting in 2016, allows states to actually have their own single-payer health care systems. Vermont has already passed legislation through its House and Senate, signed by its governor, to do just that. Are you optimistic that now that Obamacare is the law of the land, that it will lead eventually to probably a Canadian kind of experience where Saskatchewan got it and then everybody else wanted it, Vermont gets it and everybody else wants it?
I think we're on the way. I, in fact, was in Vermont yesterday and today, and I was with the governor and healthcare reform advocates just soon after we learned about the Supreme Court decision. They were very enthusiastic about what they have been able to accomplish so far. It takes a while for them to implement the single-payer plan, but they've made great strides. And if Vermont can pull this off, I do think that other and larger states will take notice and follow suit, just like happened, as you noted, in Canada. It started there in Saskatchewan, and other provinces took notice, and it eventually became the law of Canada. That can and probably will happen here. It'll take a while. It'll even take a while for Vermont to do this. They'll need waivers from the government to enact this before 2017, but they are on the way, and that's very exciting news.
Yeah. Mitt Romney is out today saying he's going to repeal and replace this thing. The repeal part is apparently going to happen in the House of Representatives on July 9th. What would America look like? What would our health care landscape look like if Romney was elected, if Republicans held control of the House and kept a veto in the Senate, or even took control of the Senate and followed through on that?
You know, if we know that we have a health care crisis in this country. If that were to happen, we haven't seen anything yet. We know, or at least I know, and I think most Americans should know, that many of the problems that we have with our healthcare system is being caused by the takeover of our healthcare system by big for-profit corporations. And I think that would accelerate, certainly, under a Romney administration. And despite the fact that he implemented Romneycare, or was governor when Massachusetts achieved a pretty decent healthcare reform law in Massachusetts. But From what he's saying on the campaign trail, there's no doubt in my mind that he and Republicans, if the industry is successful in electing more Republicans to the Senate and to defeat Barack Obama, they would run our healthcare system far more than they do today, which is a very scary thought.
Yeah, absolutely. Wendell Potter, thank you so much for being with us tonight.
Thank you, Tom.